Hospital services in Vietnam. According to the Administration Medical Service, Vietnamese Ministry of Health, Vietnam has a total of 1,336 hospitals with approximately 300,000 beds, or 15 beds per 10,000 people. Out of these total number of hospitals nationwide, there are 38 national hospitals, 492 provincial-level hospitals, and 629 district-level hospitals. Vietnam has predominantly public provision of hospital services, with 87% of public hospitals and 95% of hospital beds. In other words, private sector is relatively small, accounting for 12% of hospitals and 5% of hospital beds. The hospital services provide medical services for clients. Major functions of a hospital: medical services, medical education for staff and medical students, scientific research, medical guideline for lower-level hospitals, preventive medicine, external relations and cooperation, health economics and management. A daily shift meeting in hospital. Hospital 198 is a leading Grade 1 national hospital of Ministry of Public Security. Hospital includes 550 beds with 39 faculties, departments, centers, and wards. 7 a.m. As usual, all staff start their 8-hour working days with a daily shift meeting in the morning. Daily shift meeting is the fundamental element in evaluating medical services provided the previous day and preparing work for the current day. The staff in the meeting discussed acute care, severe cases, referral of patients, and those having operation. Daily shift meeting brings together director, representatives of medical faculties, departments, and professional staff in shift. Medical faculties departments have their daily shifts before the representatives participating in the hospital meeting. In July, there were 548 patients with dengue fever, whereas 173 were admitted as inpatients. In August, there were 1,268 patients with dengue fever, whereas 393 were admitted as inpatients. In September, there were 1,195 patients with dengue fever, whereas 285 were admitted as inpatients. The dengue fever reaches its highest case in August, with 2.5 times higher than that in July. In September, the number of patients had slightly reduced, but we need further efforts in disease prevention and control with a focus on counseling for patients when they discharge. During the daily meeting, health staff often discuss and share their experience, lesson learned, and professional guidelines on acute care and severe cases. The patient was admitted with the pain in his right ear. Other symptoms are many days of pain, worse at night, tinnitus in right ear, difficulty sleeping, no discharge, no fever, and no coughing. The patient had not received any treatment before admission. Ultrasound of ear, nose, and throat. Inflammation of the right ear canal with a bile duct in left eardrum, fluid in left nasal septa, and tonsillitis. Diagnosis is inflammation of the ear canal, otitis externa, left nasal septal abscess, and tonsillitis. The patient had been treated with cantibiotics and antibiotics to relieve pain and swelling. The intended treatment is to continue treatment with antibiotics and septoplasty. This case has been treated properly. The daily meeting lasts within 30 minutes. Later, professional staff rush back to their faculty's department and start their daily work. Medical care for patients. Severe cases are thoroughly monitored 24/7 by staff in charge and other professional staff. Heartbeat, temperature, and blood pressure are continuously monitored in case of emergency. Diagnosis consultation is performed by different specialists for acute and/or emergent cases. The patient, as a result, has the best opportunity for a positive health outcome given that diagnosis is accurate and made in a timely manner. This is also an effective way to share knowledge and experiences amongst health staff. The daily shift meeting is one of the best methods to improve the experience sharing and knowledge improvement amongst health staff. Health staff's work is much better as their clinical decision-making will be tailored to the group agreement and understanding of the patient's health issues. Medical education for staff and medical students is also an important task for senior staff. Students from universities of medicine and pharmacy have the chance to learn and practice clinical work. With modern and synchronous equipment and enthusiastic, skillful, and wholehearted health staff and specialists, Hospital 19-8 is always the first choice for medical services.